Hey guys, tonight we're diving into the world of ancient medicine, where healing often meant suffering, cures frequently caused more harm than the disease itself, and where the line between treatment and torture was razor thin. From trepanation to bloodletting, from mercury poisoning disguised as medicine, to surgical procedures that would make modern horror films seem tame, we're exploring why you absolutely wouldn't want to get sick in the ancient world. So before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. And let me know in the comments where you're tuning in from and what time it is for you. It's always fascinating to see who's joining us from around the world. Now dim the lights. Maybe turn on a fan for that soft background hum. And let's ease into tonight's journey together. Picture this. You wake up one morning in ancient Rome with a splitting headache. Nothing unusual. Just the kind of pain that makes you want to crawl back under your wool blanket and hide from the world. In our time, you might reach for some ibuprofen, drink some water, maybe take a warm shower. But in ancient Rome, your options are significantly more terrifying. Your local medicus might suggest drilling a hole in your skull to release the evil spirits causing your pain. Or perhaps he'll recommend a good bloodletting session, opening your veins to drain the corrupted humors that are clearly causing your suffering. Maybe, if you're lucky, he'll simply prescribe a mixture of crushed pearls, powdered unicorn horn, and the ground-up mummy of an Egyptian pharaoh, mixed with wine and taken 3 times daily. Welcome to the horrifying reality of ancient medicine, where good intentions paved the road to unspeakable suffering, where the cure was often worse than the disease, and where survival often had more to do with luck than treatment. This isn't just a story about primitive medical practices. It's a journey through humanity's desperate, often misguided attempts to understand the human body, to combat disease, and to cheat death itself. And along the way, we'll discover that some of the most well-meaning healers in history were actually inflicting torments that would make medieval torture devices seem merciful by comparison. Let's start our journey in ancient Egypt, often considered the birthplace of organized medicine. The Egyptians were remarkably advanced in many ways. They had a complex understanding of anatomy thanks to their mummification practices. They kept detailed medical records on papyrus scrolls, and they even had specialized physicians for different parts of the body. But here's where things get interesting. And by interesting, I mean absolutely horrifying. Egyptian medicine was built on the belief that illness was caused by supernatural forces, angry gods, or evil spirits that had somehow invaded the body. This meant that treatment often involved a combination of practical remedies and magical incantations that were supposed to drive out the malevolent forces. Sounds harmless enough, right? Well, let's dive deeper into what this actually meant for patients. If you developed an eye infection in ancient Egypt, your physician might prescribe a treatment that involved applying a mixture of honey, antimony, and ground-up pig's eye directly to your infected eye. The reasoning was that like cures like, so using the eye of an animal would help heal your eye. The honey actually had some antibacterial properties, so this wasn't entirely useless. But the other ingredients could cause severe chemical burns, blindness, or infection that was far worse than your original problem. But that was just the beginning. Egyptian physicians believed that many illnesses were caused by evil spirits entering the body through various orifices. So they developed treatments designed to make the body an inhospitable place for these spirits to live. This led to some truly nightmarish remedies. For instance, if you had a stomach ailment, your doctor might prescribe a mixture that included crocodile dung, honey, and fermented fish, taken orally. The idea was that the combination would be so foul that any self-respecting evil spirit would flee your body immediately. The reality was somewhat different. Crocodile dung is loaded with bacteria, parasites, and toxins. Consuming it would likely cause severe gastrointestinal distress, dehydration, and potentially fatal infections. But hey, at least the evil spirits were probably gone, mainly because you might be dead. Egyptian surgical procedures were equally terrifying. They performed some of the world's first documented surgeries, including procedures to remove tumors, set broken bones, and even perform basic brain surgery. But remember, this was thousands of years before the invention of anesthesia, antiseptics, or even a basic understanding of infection control. Imagine lying on a stone table in an Egyptian temple while a physician approaches you with bronze knives, copper needles, and linen bandages that have been used on dozens of previous patients. There's no way to numb the pain, no way to prevent infection, and no real understanding of why some patients lived while others died in agony days later. The Egyptians did have some pain management techniques, but they were primitive and often dangerous. They might give you a mixture of alcohol and opium-derived substances, which could help with pain but also risked overdose, respiratory depression, or addiction. Or they might use pressure points and primitive acupuncture techniques, which were safer but far less effective for major surgical procedures. One of the most disturbing aspects of Egyptian medicine was their approach to mental illness. They believed that mental disorders were caused by angry gods or demon possession, which meant that treatment often involved exorcism rituals that could last for days or weeks. Patients might be subjected to prolonged fasting, physical restraints, exposure to extreme temperatures, or ritualistic scarification designed to drive out the evil spirits. The Edwin Smith Papyrus, one of the oldest known medical texts, describes a case where a patient with what we would now recognize as a traumatic brain injury was treated by having his skull opened and hot oil poured directly onto his exposed brain tissue. The reasoning was that the heat would drive out the evil spirits, and the oil would provide protection against future supernatural attacks. Needless to say, the patient didn't survive. But perhaps the most chilling aspect of Egyptian medicine was their attitude toward experimentation. Egyptian physicians were not bound by modern ethical standards or concepts of informed consent. Patients, especially slaves and prisoners, were often subjected to experimental treatments with no regard for their well-being or survival. Medical papyri describe procedures where physicians would deliberately induce certain conditions in healthy patients just to study the progression of the disease and test potential treatments. The Ebers Papyrus, another major medical text, describes a physician who infected healthy slaves with various diseases to test different remedies. The survival rate for these unwilling test subjects was appallingly low, but the knowledge gained was considered valuable enough to justify the human cost. Egyptian embalmers also provided a unique opportunity for anatomical study, but this came with its own horrors. Living physicians would sometimes be invited to observe the mummification process, watching as embalmers removed organs from recently deceased bodies. But the line between observation and experimentation was often blurred. There are accounts of physicians performing vivisections on condemned criminals, studying their anatomy while they were still alive and conscious. The process typically involved making careful incisions to expose internal organs, while keeping the subject alive as long as possible. Physicians would observe the function of the heart, lungs, liver, and other organs in real time, taking notes on their findings, while the victim slowly died from blood loss and trauma. This practice was considered not only acceptable, but necessary for advancing medical knowledge. Moving north and forward in time, we encounter the ancient Greeks, who are often credited with founding rational medicine and moving away from purely supernatural explanations for illness. Hippocrates, the father of medicine, established the famous Hippocratic Oath with its principle of, first, do no harm. This sounds much more civilized and humane than Egyptian medicine, doesn't it? Well, let's examine the reality of Greek medical practice and see if it lives up to its reputation. Greek medicine was indeed more systematic than its Egyptian predecessor, but it was built on a foundation of theories that were completely wrong and led to treatments that were often more harmful than helpful. The cornerstone of Greek medical theory was the concept of the four humours: blood, phlegm, yellow bile, and black bile. According to this theory, health was maintained by keeping these four humours in perfect balance, and illness occurred when one or more humours became excessive or deficient. This sounds reasonable in theory, but the practical applications were horrifying. If you went to a Greek physician complaining of fever, he might diagnose you with an excess of blood, which would require immediate bloodletting to restore balance. The bloodletting process involved making deep cuts in your arms, legs, or neck, and allowing large quantities of blood to drain out until you felt faint or lost consciousness. The amount of blood removed could be enormous, sometimes as much as a third of your total blood volume. But bloodletting was just the beginning. Greek physicians also believed in the therapeutic value of purging, which involved inducing violent vomiting and diarrhea to expel corrupted humors from the body. The substances used to achieve this purging were often highly toxic. Hellebore, a plant that contains cardiac glycosides, was commonly used to induce vomiting, but it could also cause cardiac arrest, respiratory failure, and death. Patients would be given increasingly large doses until they began vomiting uncontrollably, and many died from the treatment rather than the original illness. Greek surgical procedures were marginally more advanced than Egyptian techniques, but they were still performed without anesthesia and under primitive conditions. Greek surgeons developed some sophisticated tools and techniques, including trepanation drills for skull surgery, bone saws for amputations, and various forceps and probes for internal procedures. But the mortality rate for major surgery was still extremely high, and the survival rate had more to do with the patient's constitution than the surgeon's skill. One particularly brutal Greek surgical procedure was the treatment of kidney stones. Greek physicians understood that kidney stones caused excruciating pain and could be fatal if left untreated. So they developed a surgical technique to remove them. The procedure involved making a deep incision in the patient's back, cutting through muscle and tissue until the kidney was exposed, then carefully extracting the stones with primitive forceps. The patient would be held down by several assistants while fully conscious and aware throughout the entire procedure. There was no way to control bleeding effectively, no understanding of sterile technique, and no antibiotics to prevent the inevitable infection that followed. Most patients died within days of the surgery from blood loss, infection, or organ failure. But the few who survived were held up as examples of Greek medical prowess. Greek medicine also had some truly bizarre theories about human anatomy and physiology that led to dangerous treatments. They believed that the brain was primarily a cooling system for the blood, and that mental functions were actually controlled by the heart. This led to treatments for mental illness that focused on the cardiovascular system rather than the brain. Patients with depression or anxiety might be subjected to extreme physical exercise designed to heat up their blood, or they might be given cardiac stimulants that could cause heart palpitations, arrhythmias, or cardiac arrest. Greek physicians also believed that women's health problems were usually caused by a wandering uterus that could travel around the body, causing various symptoms. This led to treatments that involved trying to lure the uterus back to its proper position using strong-smelling substances. Women with gynecological problems might have pungent herbs burned near their genitals, while foul-smelling substances were held near their noses. The theory being that the uterus would flee from the bad smell above and return to the good smell below. But perhaps the most disturbing aspect of Greek medicine was the practice of medical slavery. Greek physicians often owned slaves specifically for the purpose of medical experimentation and training. These medical slaves would be subjected to various procedures, treatments, and experimental techniques, with no regard for their pain, suffering, or survival. They were considered property rather than patients, and their lives were considered expendable in the pursuit of medical knowledge. The famous Greek physician Galen, whose theories dominated Western medicine for over 1,000 years, conducted many of his anatomical studies by performing vivisections on enslaved gladiators and criminals. He would make careful observations of their internal organs while they were still alive, taking detailed notes on the function of various body systems while his subjects slowly died from the procedures. Moving forward to the Roman Empire, we find a medical system that was heavily influenced by Greek theories, but applied with characteristic Roman efficiency and brutality. Roman medicine was more organized and systematic than its predecessors, with military hospitals, specialized physicians, and the beginnings of public health measures. But it was also more callous and utilitarian, viewing patients as problems to be solved rather than people to be healed. Roman military medicine provides some of the most horrifying examples of ancient medical practice. Roman army surgeons were expected to keep soldiers fighting ready at all costs, which led to treatments that prioritized speed and effectiveness over patient comfort or long-term health. If a soldier was wounded in battle, the priority was to get him back to fighting condition as quickly as possible, regardless of the cost in pain and suffering. Roman field surgery was performed in conditions that were appallingly unsanitary, even by ancient standards. Surgeons would work on multiple patients without washing their hands or cleaning their instruments, spreading infection from one patient to another. Surgical tools were sharpened on whatever was available, including stones, leather, or metal armor, which left them covered in debris and contaminants that were then introduced into surgical wounds. Amputation was common in Roman military medicine, and it was performed with shocking brutality. A wounded soldier might have his limb amputated while fully conscious, with nothing more than a leather strap to bite down on for pain relief. The amputation would be performed with a bone saw that was often dull and dirty, requiring the surgeon to hack through bone and tissue with repeated cutting motions that could take many minutes to complete. To control bleeding during amputation, Roman surgeons would heat iron bars until they were red hot and then apply them directly to the severed blood vessels, cauterizing them closed. The smell of burning flesh, the sound of sizzling tissue, and the screams of the patient were considered normal parts of the surgical process. Many patients died from shock, blood loss, or infection, but those who survived were expected to return to duty as soon as possible. Roman civilian medicine was somewhat less brutal than military medicine, but it still involved treatments that would be considered torture by modern standards. Roman physicians had access to a wider variety of drugs and treatments than their predecessors, but many of these substances were highly toxic and often caused more harm than good. Mercury was widely used in Roman medicine to treat a variety of conditions, from skin diseases to syphilis to mental illness. Patients would be given mercury orally, applied to their skin, or even injected into body cavities. Mercury poisoning causes severe neurological damage, kidney failure, and death, but Roman physicians interpreted the symptoms of mercury poisoning as signs that the treatment was working and the disease was being driven from the body. Lead was another common treatment in Roman medicine, used both internally and externally for various conditions. Lead acetate, known as sugar of lead because of its sweet taste, was used to treat stomach ailments, skin conditions, and even as a general tonic for improving health. Lead poisoning causes brain damage, organ failure, and death. But it often took weeks or months for the symptoms to appear, so physicians didn't make the connection between the treatment and the patient's deteriorating condition. Roman obstetric medicine provides some of the most disturbing examples of ancient medical practice. Childbirth was extremely dangerous in the ancient world, with maternal mortality rates as high as 25% for first-time mothers. Roman physicians developed various techniques to assist with difficult births, but these techniques were often more harmful than helpful. If a baby was positioned incorrectly in the womb, Roman physicians might attempt to manually reposition it by reaching into the uterus with their bare hands and manipulating the fetus. This procedure was performed without anesthesia, antiseptics, or any understanding of infection control, and it often resulted in severe internal injuries, massive bleeding, and fatal infections. In cases where the baby had died in the womb, Roman physicians had developed specialized instruments for extracting the dead fetus piece by piece. These instruments, including hooks, knives, and crushing devices, were designed to dismember the dead baby inside the womb so that it could be removed without performing a caesarean section, which was usually fatal for the mother. The process of embryotomy, as it was called, involved inserting these instruments into the uterus while the mother was fully conscious and aware, then carefully cutting the dead baby into pieces small enough to be extracted. The procedure could take hours to complete, and the mother would be conscious throughout the entire process, experiencing unimaginable pain and psychological trauma. Many mothers died from blood loss, infection, or shock during or after the procedure. Roman medicine also had a disturbing approach to mental illness and neurological disorders. Mental illness was often attributed to possession by evil spirits, moral weakness, or divine punishment, which led to treatments that were designed to punish the patient rather than heal them. Patients with mental illness might be chained up in temples, subjected to exorcism rituals, or given treatments designed to shock them back to sanity. One common treatment for mental illness was rotational therapy, where patients would be strapped to a spinning wheel and rotated at high speed until they became dizzy and disoriented. The theory was that this would shake the evil spirits loose from their brains and restore them to sanity. In practice, it often caused severe motion sickness, disorientation, and sometimes permanent brain damage from the violent spinning motion. Roman physicians also used electric eels and electric rays as medical treatments, applying them directly to patients' bodies to deliver electric shocks. This electroshock therapy was used to treat everything from headaches to mental illness to paralysis. While electric stimulation can have some legitimate medical applications, the Roman approach was crude and uncontrolled, often causing severe burns, cardiac arrhythmias, and other serious injuries. As we move into the medieval period, medicine becomes even more horrifying, combining the worst aspects of ancient theories with new forms of religious superstition and social control. Medieval medicine was dominated by the Catholic Church, which viewed illness as divine punishment for sin and treated medical practice as a form of religious ritual rather than empirical science. The medieval period saw the rise of the four humours theory to its most extreme and dangerous applications. Medieval physicians believed that virtually every illness was caused by an imbalance of humours, and they developed increasingly aggressive treatments to correct these supposed imbalances. Bloodletting became more systematic and frequent, with physicians developing complex charts and calendars to determine the optimal times for bleeding patients based on astrological calculations and religious festivals. Medieval bloodletting techniques were more sophisticated than their ancient predecessors, but they were also more dangerous. Physicians developed specialized tools, including lancets, fleams, and scarificators, for making precise cuts in veins and arteries. They also used leeches, cupping glasses, and even mechanical devices designed to extract specific quantities of blood with mathematical precision. The amount of blood removed during medieval bloodletting sessions was often massive. Physicians might remove several pints of blood in a single session, sometimes continuing the bloodletting over multiple days until the patient was severely anemic or unconscious. The theory was that the more corrupted blood was removed, the more completely the patient would be healed, but in practice, this often led to severe anemia, weakness, and death from blood loss. Medieval physicians also developed the practice of prophylactic bloodletting, where healthy people would have blood removed on a regular schedule to prevent illness from developing. This was especially common among wealthy patients who could afford regular medical attention. Some people would have blood removed monthly or even weekly, gradually weakening their constitution and making them more susceptible to the very illnesses they were trying to prevent. The medieval period also saw the development of increasingly exotic and dangerous pharmacological treatments. Medieval pharmacies, known as apothecaries, stocked hundreds of different substances, many of which were highly toxic. The medieval approach to pharmacy was based on the principle that the more exotic and expensive an ingredient was, the more powerful its healing properties must be. This led to the use of substances like powdered unicorn horn, which was actually ground narwhal tusk and had no medicinal properties but cost more than gold. Patients with serious illnesses might be given treatments that included powdered pearls, ground gemstones, pulverized mummy remains, and various animal parts that were supposed to transfer the strength or characteristics of the animal to the patient. Mummy powder was especially popular in medieval medicine. Wealthy patients would pay enormous sums for genuine Egyptian mummy remains, which would be ground into powder and taken internally or applied externally to treat various conditions. The practice became so popular that it led to a thriving trade in fake mummy powder, made from recently deceased bodies that had been artificially aged and prepared to look like ancient mummy remains. The actual medicinal value of mummy powder was zero, but the psychological effect on patients was significant. Many people believed so strongly in its healing properties that they experienced a placebo effect, which reinforced the physician's belief in its effectiveness. However, the practice also spread diseases, including tuberculosis, plague, and various parasitic infections that were present in the mummy remains. Medieval surgery was perhaps the most terrifying aspect of medieval medicine. Surgical procedures were performed in conditions that were appallingly unsanitary, with no understanding of infection control, antiseptics, or anesthesia. Medieval surgeons often worked in barber shops, private homes, or even outdoor markets, using whatever tools were available and whatever surface was convenient. The mortality rate for medieval surgery was extremely high, with some estimates suggesting that more than 80% of surgical patients died from their procedures. Death was usually caused by infection, blood loss, or shock, rather than the surgical technique itself. But medieval physicians didn't understand the connection between surgical conditions and patient outcomes. Medieval surgeons did have some effective techniques for certain procedures. They were skilled at setting broken bones, removing superficial tumors, and performing basic wound care. But any procedure that required opening body cavities or working on internal organs was essentially a death sentence for the patient. Trepanation, the practice of drilling holes in the skull, reached its peak during the medieval period. Medieval physicians believed that many mental and neurological conditions were caused by evil spirits or corrupted humors trapped inside the skull, and they developed increasingly sophisticated techniques for creating openings to allow these substances to escape. Medieval trepanation was performed with hand-operated drills, saws, and scrapers, often taking hours to complete a single hole. The patient would be fully conscious throughout the procedure, restrained by assistants, while the surgeon slowly worked through the layers of skin, muscle, and bone to reach the brain tissue underneath. The mortality rate for trepanation was extremely high, with most patients dying from infection, brain damage, or bleeding. But the few patients who survived were held up as evidence of the procedure's effectiveness, and trepanation continued to be performed throughout the medieval period and beyond. Medieval obstetric medicine was particularly horrifying, with maternal mortality rates reaching 30% or higher in some areas. Medieval physicians had little understanding of female anatomy and pregnancy, and their treatments were often based on superstition and religious doctrine rather than medical knowledge. Difficult births were often attributed to the mother's sinful behavior, and treatment might involve religious rituals, exorcism, or physical punishment designed to drive out the evil spirits that were supposedly causing the complications. Women in labor might be forced to confess their sins, undergo religious trials, or submit to painful procedures that were supposed to purify them spiritually. Medieval caesarean sections were occasionally performed, but only after the mother had died or was clearly dying. The procedure was considered a last resort to save the baby's life, and it was usually performed by clergy rather than physicians. The mother's survival was not expected or even desired, as the procedure was seen as a way to ensure that the baby could be baptized before death. The tools used for medieval obstetric procedures were crude and often improvised. Forceps had not yet been invented, so physicians relied on manual manipulation, hooks, and various pulling devices to assist with difficult births. These tools often caused severe internal injuries, and the lack of antiseptic technique meant that infection was almost inevitable. Medieval medicine also had a particularly disturbing approach to pediatric care. Children were considered miniature adults rather than beings with unique physiological needs, and they were often subjected to the same brutal treatments as adult patients. Childhood illnesses were frequently attributed to moral failings or supernatural causes, leading to treatments that were designed to punish the child rather than heal them. Children with developmental disabilities or mental illness were often considered possessed by demons or cursed by God, and they might be subjected to exorcism rituals, physical restraints, or abandonment. Some were sent to monasteries or convents where they were kept in isolation and subjected to religious treatments that often included fasting, physical punishment, and various forms of deprivation. The medieval period also saw the rise of plague medicine, as Europe was repeatedly devastated by bubonic plague outbreaks that killed millions of people. Medieval physicians had no understanding of the bacterial cause of plague, and their treatments were not only ineffective, but often made the situation worse. Plague treatments included bloodletting, purging, and the application of various poultices and ointments to the characteristic buboes or swollen lymph nodes. Many of these treatments involved lancing the buboes and draining the infected fluid, which often spread the infection to other parts of the body or to other people. Medieval plague physicians wore distinctive protective costumes including long leather coats, gloves, and beaked masks filled with aromatic herbs. These costumes provided some protection against airborne infection, but they also made the physicians look like terrifying bird-like creatures, adding to the psychological trauma of plague victims who were already suffering from a painful and usually fatal disease. The beaked masks worn by plague doctors were filled with a mixture of aromatic herbs, spices, and other substances that were supposed to purify the air and protect against infection. The mixture often included theriaca, a complex compound that contained dozens of ingredients, including viper's flesh, opium, and various toxic plants. Plague doctors would breathe this mixture for hours at a time, often suffering from poisoning symptoms including hallucinations, respiratory problems, and neurological damage. As we move into the Renaissance period, we might expect medical practice to become more humane and scientific, but in many ways, Renaissance medicine was even more horrifying than its medieval predecessor. The Renaissance saw the rise of human dissection and anatomical study, which led to important advances in understanding human anatomy. But it also led to practices that were shocking even by the standards of the time. Renaissance physicians had access to a much wider variety of drugs and treatments than their predecessors, but many of these new substances were highly toxic and often caused more harm than good. The Renaissance period saw the introduction of mercury, antimony, and various mineral-based treatments that were supposed to be more powerful and effective than traditional herbal remedies. Mercury became the treatment of choice for syphilis, a disease that had recently appeared in Europe and was causing widespread panic. Patients with syphilis would be subjected to mercury treatments that involved rubbing mercury ointment into their skin, taking mercury internally, or being placed in heated chambers filled with mercury vapor. These treatments were based on the theory that mercury would drive the syphilis from the body, but in reality, they caused severe mercury poisoning that was often more debilitating than the original disease. Mercury treatment for syphilis typically involved placing the patient in a heated wooden box or small room with pans of liquid mercury that would be heated until it produced toxic vapors. The patient would be forced to inhale these vapors for hours at a time, often developing severe respiratory problems, neurological damage, and kidney failure. The treatment was so toxic that it gave rise to the saying, "A night with Venus, a lifetime with Mercury," referring to the lifelong health problems caused by mercury treatment for sexually transmitted diseases. Renaissance surgery became more sophisticated, but also more brutal, as surgeons gained access to better tools and techniques, but still had no effective anesthesia or infection control. Renaissance surgeons developed new procedures for treating injuries and diseases, but these procedures were often performed under conditions that guaranteed high mortality rates. One of the most notorious Renaissance surgical procedures was lithotomy, the surgical removal of bladder stones. Bladder stones were a common and extremely painful condition, and Renaissance surgeons developed techniques for removing them through surgical incision. The procedure involved restraining the patient in a special chair, making a deep incision in the perineum, and manually extracting the stones through the incision. The lithotomy procedure was performed without anesthesia, and patients would be fully conscious throughout the operation. The pain was so intense that many patients died from shock during the procedure, and those who survived often developed severe infections that were frequently fatal. The mortality rate for lithotomy was estimated to be around 50%, but the procedure continued to be performed because the alternative was a slow, painful death from bladder obstruction. Renaissance medicine also saw the development of increasingly complex and dangerous pharmaceutical preparations. Renaissance apothecaries created elaborate compounds that might contain dozens or even hundreds of different ingredients, including exotic substances imported from around the world. These polypharmacy preparations were supposed to be more effective than simple remedies, but they often caused unpredictable side effects and toxic interactions. One of the most famous Renaissance pharmaceutical preparations was theriac, also known as Venice treacle, which was supposed to be a universal antidote for poisons and a cure for various diseases. Theriac contained more than 60 different ingredients, including viper's flesh, opium, various herbs and spices, and precious stones. The preparation was extremely expensive and took months to prepare, and it was considered one of the most powerful medicines available. In reality, theriac was probably more harmful than helpful. The combination of so many different substances created a high risk of toxic interactions, and the presence of opium made it addictive. Many patients who took theriac regularly became dependent on it and suffered withdrawal symptoms when it was discontinued. Renaissance physicians also developed new techniques for treating mental illness, but these techniques were often more brutal than previous approaches. Renaissance medicine embraced the idea that mental illness could be cured through shock therapy, physical restraint, and various forms of sensory deprivation or overstimulation. Patients with mental illness might be subjected to spinning chairs that would rotate them at high speed until they became violently ill, ice-cold baths that could cause hypothermia and cardiac arrest, or various mechanical devices designed to restrain them in uncomfortable positions for extended periods. These treatments were based on the theory that mental illness was caused by physical imbalances that could be corrected through physical manipulation, but they often caused severe physical and psychological trauma. Renaissance medicine also saw the development of new approaches to treating female reproductive health. But these approaches were often based on misogynistic beliefs about women's bodies and psychology. Renaissance physicians believed that women were inherently weaker and more susceptible to illness than men, and they developed treatments that were designed to control and modify female behavior as much as to treat medical conditions. Women with gynecological problems might be subjected to treatments that included bloodletting, purging, and the application of various caustic substances to their genital area. These treatments were often extremely painful and could cause permanent damage, but they were considered necessary to correct the supposed defects in women's bodies and minds. The Renaissance period also saw the rise of iatrochemistry, the application of chemical principles to medical treatment. Iatrochemists believed that disease was caused by chemical imbalances in the body that could be corrected through the administration of chemical compounds. This led to the use of increasingly powerful and toxic substances in medical treatment. Antimony became a popular iatrochemical treatment for various conditions, but antimony compounds are highly toxic and often caused severe poisoning. Patients treated with antimony would develop symptoms, including vomiting, diarrhea, cardiac arrhythmias, and neurological damage, but physicians interpreted these symptoms as signs that the treatment was working and the disease was being driven from the body. Paracelsus, one of the most famous Renaissance physicians, advocated for the use of chemical medicines and coined the famous phrase, "The dose makes the poison." However, his approach to determining appropriate doses was crude and often dangerous. He believed that medicines should be given in doses large enough to cause visible effects, which often meant giving patients toxic quantities of dangerous substances. As we move into the early modern period, medical practice becomes somewhat more systematic, but it also becomes more institutionalized and therefore more difficult for patients to escape from harmful treatments. The early modern period saw the establishment of hospitals, medical schools, and professional medical organizations, which created more opportunities for medical abuse and experimentation. Early modern hospitals were often more like prisons than healing institutions. Patients were confined to crowded, unsanitary wards where infectious diseases spread rapidly and mortality rates were extremely high. Hospitals were primarily institutions for the poor, as wealthy patients preferred to be treated in their own homes where they could control the conditions of their care. The conditions in early modern hospitals were appalling. Patients were often housed in overcrowded rooms with poor ventilation, inadequate heating, and no sanitation facilities. Multiple patients might share the same bed, spreading diseases and infections among the patient population. The mortality rate in many hospitals was higher than 50%, leading to the popular belief that hospitals were places where people went to die rather than to be healed. Hospital staff were often untrained and poorly supervised, and patient abuse was common. Patients might be subjected to experimental treatments without their knowledge or consent, used as teaching materials for medical students, or simply neglected if their conditions were considered untreatable. The lack of effective pain management meant that patients suffered through their illnesses and treatments in agony, with only alcohol or opium available for the most severe cases. Early modern medicine also saw the development of more systematic approaches to mental health treatment, but these approaches were often more inhumane than previous methods. The early modern period saw the establishment of the first dedicated mental health institutions, known as madhouses or asylums, which were supposed to provide specialized care for patients with mental illness. In reality, early modern asylums were often little more than prisons where mentally ill patients were confined, restrained, and subjected to brutal treatments that were designed to control their behavior rather than improve their mental health. Patients might be chained to walls, confined in small cells, or subjected to various forms of physical punishment that were supposed to shock them back to sanity. One of the most notorious early modern treatments for mental illness was the use of rotating chairs and other mechanical devices designed to disorient and confuse patients. Patients would be strapped into chairs that could be rotated at high speed, spun until they became violently ill, or subjected to various other forms of mechanical manipulation that were supposed to restore their mental balance. Cold water treatments were also popular in early modern asylums. Patients might be subjected to sudden immersion in ice-cold water, forced to stand under cold waterfalls for extended periods, or confined in cells that were deliberately kept cold and damp. These treatments were based on the theory that mental illness was caused by excessive heat in the brain, and that cold water could cool the brain and restore normal mental function. Early modern medicine also developed new approaches to treating infectious diseases, but these approaches were often based on incorrect theories and led to treatments that made epidemics worse rather than better. The early modern period saw several major epidemics of plague, cholera, and other infectious diseases, and medical authorities responded with quarantine measures, bloodletting, and various other treatments that were not only ineffective, but often harmful. Quarantine measures in the early modern period were often brutal and inhumane. Entire families might be confined to their homes for weeks or months, regardless of whether they showed signs of illness. Quarantine facilities were often overcrowded, unsanitary, and poorly supplied, leading to high mortality rates among the quarantined population. Many people died from starvation, dehydration, or secondary infections rather than from the original disease. The early modern period also saw the development of variolation, an early form of smallpox inoculation that involved deliberately infecting healthy people with smallpox in the hope of inducing a mild case that would provide immunity against future infection. Variolation was based on the observation that people who survived smallpox were immune to future infection, but the practice was extremely dangerous and often fatal. Variolation typically involved taking pus or scab material from a person with active smallpox and introducing it into a healthy person through small cuts in the skin or by having them inhale powdered scab material. The procedure was supposed to cause a mild case of smallpox that would provide lifelong immunity, but in practice, it often caused severe smallpox that was indistinguishable from naturally acquired infection. The mortality rate for variolation was estimated to be between 1% and 3%, which was lower than the mortality rate for naturally acquired smallpox, but still represented a significant risk. Many people died from variolation-induced smallpox, and others suffered severe scarring, blindness, or other complications. Despite these risks, variolation was widely practiced in the early modern period because the risk of natural smallpox infection was considered even greater. Early modern obstetric medicine remained extremely dangerous, with maternal mortality rates that were among the highest in human history. Early modern physicians had little understanding of the causes of childbirth complications, and their interventions often made difficult births more dangerous rather than safer. The use of obstetric forceps was introduced in the early modern period, but these early forceps were crude and often caused severe injuries to both mother and baby. The forceps were often used inappropriately, applied too forcefully, or used in situations where they were not needed, leading to unnecessary trauma and complications. Early modern physicians also developed new techniques for managing complicated pregnancies, but these techniques were often based on incorrect theories about pregnancy and fetal development. For example, physicians believed that the position of the fetus in the womb could be controlled through external manipulation, leading to aggressive techniques for trying to reposition babies that often caused uterine rupture, placental separation, and other life-threatening complications. The early modern period also saw the development of new surgical techniques, but surgery remained extremely dangerous due to the lack of effective anesthesia and infection control. Early modern surgeons developed new procedures for treating injuries and diseases, but the mortality rate for major surgery remained very high. Amputation became more common in the early modern period, particularly for treating infected wounds and traumatic injuries. Early modern surgeons developed new techniques for performing amputations more quickly and efficiently, but these procedures were still performed without anesthesia and under primitive conditions. Patients would be restrained by several assistants while the surgeon worked as quickly as possible to minimize the duration of the procedure. The speed of early modern amputation was considered crucial for patient survival, as prolonged surgery increased the risk of death from shock and blood loss. Surgeons prided themselves on their ability to perform amputations in a matter of minutes, but this emphasis on speed often led to poor surgical technique and complications that could have been avoided with more careful attention to detail. Early modern medicine also saw the development of new pharmaceutical preparations, but many of these preparations were based on incorrect theories about drug action and often contained toxic substances that were more harmful than helpful. The early modern period saw the introduction of various mineral-based medicines, including preparations containing mercury, lead, antimony, and other heavy metals. These mineral medicines were supposed to be more powerful and effective than traditional herbal remedies, but they often caused severe poisoning and long-term health problems. Patients treated with mineral medicines might develop symptoms including neurological damage, kidney failure, and various other complications that were often attributed to the original disease rather than to the treatment. The early modern period also saw the development of new approaches to pain management, but these approaches were still primitive and often dangerous. Opium became more widely available in the early modern period, but its use was poorly controlled and often led to addiction and overdose. Alcohol remained the primary pain reliever for most procedures, but the quantities required for effective anesthesia often caused alcohol poisoning and other complications. Early modern physicians also experimented with various plant-based anesthetics, including preparations derived from mandrake, henbane, and other psychoactive plants. These preparations could provide some pain relief, but they were unpredictable in their effects and often caused dangerous side effects, including respiratory depression, cardiac arrhythmias, and coma. As we move into the 18th and early 19th centuries, medical practice begins to show some signs of improvement, but many traditional treatments remain in use and continue to cause harm to patients. The 18th century saw the beginning of more scientific approaches to medicine, including the development of clinical observation, statistical analysis, and experimental methodology. But these advances were slow to influence everyday medical practice. The 18th century also saw the continuation of many traditional medical practices that were harmful and ineffective. Bloodletting remained one of the most common medical treatments, and it was applied to an even wider range of conditions than in previous periods. 18th century physicians developed elaborate theories about the optimal timing, quantity, and technique of bloodletting, creating detailed charts and calendars for determining when and how much blood should be removed from patients. The practice of bloodletting reached its peak in the 18th century, with some physicians advocating for the removal of enormous quantities of blood from their patients. The famous physician Benjamin Rush, one of the signers of the Declaration of Independence, advocated for bloodletting treatments that involved removing up to 80% of a patient's blood volume over the course of several days. Rush believed that most diseases were caused by overstimulation of the circulatory system, and that massive bloodletting was necessary to restore the body's natural balance. Rush's bloodletting protocols were so aggressive that they often killed patients who might have recovered from their original illnesses. During the yellow fever epidemic in Philadelphia in 1793, Rush treated thousands of patients with massive bloodletting and purging, and the mortality rate among his patients was significantly higher than among patients treated by physicians who used less aggressive methods. The 18th century also saw the development of new mechanical devices for medical treatment, but many of these devices were more harmful than helpful. The period saw the invention of various machines for bloodletting, purging, and other traditional treatments, as well as new devices for treating mental illness and other conditions. One of the most notorious 18th century medical devices was the spinning chair, invented by Erasmus Darwin, grandfather of Charles Darwin, for treating mental illness. The spinning chair was designed to rotate patients at high speed while they were strapped into the device, supposedly to redistribute the blood flow in their brains and restore normal mental function. Patients would be spun until they became violently ill, often losing consciousness from the centrifugal force and motion sickness. The spinning chair was used to treat a wide variety of mental and neurological conditions, including depression, anxiety, hysteria, and various forms of insanity. The treatment sessions could last for hours, with patients being spun repeatedly until they showed signs of improvement, which usually meant that they were too sick and disoriented to exhibit their original symptoms. Other 18th century mechanical medical devices included various machines for administering electric shocks, devices for applying mechanical pressure to different parts of the body, and machines for inducing artificial respiration in patients who had drowned or suffocated. Many of these devices were based on incorrect theories about human physiology, and often caused more harm than good. The 18th century also saw the development of new approaches to surgical anesthesia, but these approaches were still primitive and dangerous. Surgeons experimented with various methods for reducing pain during surgery, including the use of pressure points, cold therapy, and various drugs. but none of these methods were entirely effective or safe. One of the most common approaches to surgical anesthesia in the 18th century was the use of alcohol and opium in combination. Patients would be given large quantities of alcohol to drink, followed by doses of opium or laudanum to induce unconsciousness. This combination could provide some pain relief and sedation, but it also carried significant risks of respiratory depression, cardiac arrest, and death from overdose. The dosing of alcohol and opium for surgical anesthesia was largely a matter of guesswork, as physicians had no reliable methods for measuring drug concentrations or monitoring patient responses. Many patients died from anesthesia overdoses, while others received insufficient medication and remained conscious and in pain throughout their surgical procedures. The 18th century also saw the continued use of mercury for treating syphilis and other conditions, despite growing evidence that mercury treatment was often more harmful than the diseases it was supposed to cure. Mercury treatment protocols became even more aggressive in the 18th century, with patients being subjected to increasingly high doses and longer treatment periods. The most extreme form of mercury treatment in the 18th century was known as salivation therapy, which involved giving patients enough mercury to cause excessive salivation, tooth loss, and neurological damage. The theory was that syphilis could be sweated out through the excessive saliva production, but in reality, the treatment caused severe mercury poisoning that often led to permanent disability or death. Salivation therapy typically involved placing patients in heated rooms and giving them large doses of mercury compounds until they began producing several quarts of saliva per day. The treatment would continue for weeks or months until the patients showed signs of improvement, which usually meant that they were too sick from mercury poisoning to show symptoms of their original condition. The 18th century also saw the development of new approaches to treating female reproductive health. But these approaches were often based on misogynistic beliefs about women's bodies and sexuality. 18th century physicians believed that many female health problems were caused by sexual frustration or excessive sexual desire, leading to treatments that were designed to control women's sexuality rather than address their medical needs. One of the most notorious 18th century treatments for female health problems was hydrotherapy, which involved subjecting women to various forms of water treatment, including cold baths, douches, and enemas. These treatments were supposed to cool the sexual passions and restore women to a state of proper moral and physical health. Hydrotherapy treatments for women could be extremely harsh and traumatic. Women might be subjected to sudden immersion in ice-cold water, forced to remain in cold baths for extended periods, or subjected to high-pressure douches that could cause internal injuries. The treatments were often administered against the women's will, particularly in cases where they were diagnosed with hysteria or other mental health conditions. The 18th century also saw the development of new approaches to pediatric medicine, but children continued to be treated as miniature adults rather than as beings with unique physiological needs. 18th century pediatric treatments were often just scaled-down versions of adult treatments, with little consideration for the different ways that children's bodies respond to illness and medical intervention. Childhood diseases were often treated with the same aggressive bloodletting, purging, and pharmaceutical treatments that were used for adults, but at doses that were supposedly adjusted for the child's smaller body size. However, physicians had little understanding of how to calculate appropriate pediatric doses, and children often received medications that were either ineffective or dangerously toxic. The 18th century also saw the continuation of harsh treatments for childhood behavioral problems and developmental disabilities. Children who exhibited unusual behavior or failed to develop normally might be subjected to various forms of physical restraint, punishment, or correction that were designed to force them to conform to normal expectations. As we move into the 19th century, we begin to see the emergence of more scientific approaches to medicine, but the transition from traditional to modern medicine was slow and uneven. Many harmful practices continued well into the 19th century, and some new practices introduced during this period were also harmful and based on incorrect theories. The early 19th century saw the development of phrenology, a pseudoscientific theory that claimed that personality traits and mental abilities could be determined by examining the shape and size of different areas of the skull. Phrenologists believed that the brain was composed of distinct organs that controlled different aspects of personality and behavior, and that these organs could be evaluated by feeling the bumps and depressions on a person's head. Phrenology led to various medical treatments that were based on manipulating the skull to influence personality and behavior. Some practitioners developed techniques for reshaping skulls through mechanical pressure, binding, or even surgical modification. These treatments were supposed to enhance desirable personality traits and suppress undesirable ones, but they often caused severe injuries and had no beneficial effects. The early 19th century also saw the development of homeopathy, a medical system based on the principle that like cures like, and that extremely diluted substances could have powerful healing effects. While homeopathy was generally less harmful than many traditional medical treatments, it was also largely ineffective and often prevented patients from receiving more appropriate treatment for serious conditions. Homeopathic treatments involved giving patients extremely diluted preparations of substances that were supposed to produce symptoms similar to those of the patient's illness. The preparations were diluted to such an extent that they often contained no active ingredients at all, making them essentially identical to placebos. While this meant that homeopathic treatments were usually harmless, it also meant that patients with serious illnesses often went untreated while pursuing homeopathic remedies. The early 19th century also saw the continued use of harsh treatments for mental illness, including the development of new mechanical restraints and punishment devices. 19th century asylums used various forms of mechanical restraint, including straitjackets, restraining chairs, and beds with leather straps, to control patients who were considered dangerous or disruptive. One of the most notorious 19th century psychiatric treatments was the use of the tranquilizing chair, invented by Benjamin Rush. The tranquilizing chair was designed to completely immobilize psychiatric patients by restraining their arms, legs, and head while reducing sensory input through the use of blindfolds and other devices. Patients might be confined in the tranquilizing chair for hours or days at a time, supposedly to calm their minds and restore normal mental function. The 19th century also saw the development of hydrotherapy as a treatment for mental illness and various other conditions. 19th century hydrotherapy involved subjecting patients to various forms of water treatment, including hot and cold baths, douches, wraps, and other techniques that were supposed to stimulate or calm the nervous system. Some hydrotherapy treatments were relatively mild and may have provided some psychological benefit, but others were harsh and potentially dangerous. Patients might be subjected to alternating hot and cold baths that could cause thermal shock, high-pressure water treatments that could cause physical injuries, or prolonged immersion in water that could lead to hypothermia or other complications. The 19th century also saw the development of electrotherapy, the use of electrical current to treat various medical conditions. Early electrotherapy devices were crude and often dangerous, delivering uncontrolled electrical shocks that could cause burns, cardiac arrhythmias, and other serious injuries. Electrotherapy was used to treat a wide variety of conditions, including paralysis, mental illness, sexual dysfunction, and various other ailments. The treatments involved applying electrical current directly to the patient's body using metal electrodes, often without any regard for the intensity or duration of the electrical stimulation. Some electrotherapy treatments involved applying electrical current to sensitive areas of the body, including the genitals, spine, and head. These treatments were often extremely painful and could cause permanent nerve damage, but they were considered beneficial because they produced visible muscle contractions that were interpreted as signs of healing. The mid-19th century saw some important advances in surgical technique, including the development of effective anesthesia using ether and chloroform. However, the introduction of anesthesia was met with significant resistance from many physicians and patients, and it took several decades for anesthetic techniques to become widely accepted and safely applied. Early anesthesia techniques were often dangerous and poorly controlled. Physicians had little understanding of proper dosing, monitoring, or safety procedures for anesthetic agents, and many patients died from anesthesia overdoses or complications. Ether and chloroform were highly flammable and explosive, leading to operating room fires and explosions that killed both patients and medical staff. The administration of early anesthesia was often haphazard and uncontrolled. Anesthetics might be administered by untrained assistants using improvised equipment, with no monitoring of the patient's vital signs or response to the medication. Many patients received too much anesthesia and died from respiratory or cardiac arrest, while others received too little and remained conscious during their surgical procedures. The mid-19th century also saw the development of more aggressive surgical procedures, as surgeons gained confidence from the availability of anesthesia and began attempting more complex operations. However, the lack of understanding about infection control meant that many of these ambitious surgeries resulted in severe complications and death from post-operative infections. The introduction of anesthesia led to a false sense of security among surgeons who began performing longer and more complex procedures without understanding the increased risk of infection and other complications associated with extended surgery. Many patients survived their surgical procedures only to die days or weeks later from infections that could have been prevented with proper sterile technique. The mid-19th century also saw the continued use of harsh treatments for infectious diseases, despite growing evidence that many traditional treatments were ineffective or harmful. The cholera epidemics of the 19th century led to various experimental treatments, including massive bloodletting, purging, and the administration of toxic substances including mercury, arsenic, and various mineral preparations. During cholera epidemics, physicians often resorted to increasingly desperate treatments as conventional therapies failed to show any benefit. Patients might be subjected to bloodletting that removed several pints of blood, purging treatments that caused severe dehydration, and various experimental drugs that often caused additional complications. The lack of understanding about the causes of cholera led to treatments that often made the disease worse. Physicians did not understand that cholera was caused by bacterial infection and that dehydration was the primary cause of death, so they continued to use treatments that caused further fluid loss and weakened the patient's ability to fight the infection. The late 19th century saw the beginning of more scientific approaches to medicine, including the development of germ theory and the understanding that many diseases were caused by microorganisms. However, the transition to modern medical practice was slow, and many harmful traditional treatments continued to be used alongside newer, more effective therapies. The development of germ theory led to some improvements in surgical practice, including the introduction of antiseptic techniques by Joseph Lister. However, many surgeons were slow to adopt antiseptic practices, and some actively resisted them because they found them inconvenient or because they didn't believe in the germ theory of disease. Early antiseptic techniques were often crude and sometimes harmful. Lister's original antiseptic methods involved spraying carbolic acid throughout the operating room, which could cause chemical burns and respiratory problems for both patients and medical staff. The carbolic acid was effective at killing germs, but it was also toxic to human tissue and could delay wound healing. The late 19th century also saw the development of new pharmaceutical preparations, including the introduction of aspirin, which was one of the first synthetic drugs to be widely used in medical practice. However, many new drugs were introduced without adequate testing for safety or efficacy, and some caused serious side effects or complications. The pharmaceutical industry in the late 19th century was largely unregulated, and drug manufacturers often made exaggerated claims about the effectiveness of their products. Many medications contained undisclosed ingredients, including alcohol, opium, and various toxic substances, and there were no requirements for testing or quality control. The late 19th century also saw the continued use of harsh treatments for mental illness. Despite growing recognition that many psychiatric patients were being mistreated in asylums and other institutions, the late 19th century saw some reforms in psychiatric care, but many abusive practices continued well into the 20th century. As we reach the turn of the 20th century, we can see that while medicine had begun to evolve toward more scientific and humane practices, the legacy of centuries of harmful medical treatments continued to influence medical practice. Many physicians and patients still believed in traditional treatments that had been used for hundreds or thousands of years, and it took time for new scientific understanding to replace old beliefs and practices. The transition from traditional to modern medicine was not a sudden transformation, but a gradual process that took many decades to complete. Even as new discoveries about anatomy, physiology, and disease were made, old practices persisted because they were familiar, because they seemed to work in some cases, or because they were supported by established medical authorities. The history of ancient and traditional medicine serves as a powerful reminder of how far medical practice has advanced. but it also serves as a warning about the dangers of medical treatments that are not based on scientific evidence and careful evaluation of risks and benefits. The suffering endured by countless patients throughout history should not be forgotten, but should serve as motivation for continued improvement in medical practice and patient care. The lessons from this dark history of medicine are still relevant today, as we continue to grapple with questions about medical ethics, patient rights, and the balance between potential benefits and risks of medical treatments. The story of ancient medicine reminds us that good intentions are not enough to ensure good medical care, and that rigorous scientific evaluation and compassionate patient care must always be the foundation of medical practice. Looking back at this horrifying journey through the history of medicine, we can see that the development of modern medical practice was not inevitable, but required countless experiments, failures, and hard-won insights about the human body and the nature of disease. The patients who suffered through these primitive treatments were not just victims of ignorance, but unwilling participants in humanity's long struggle to understand and treat illness. The transformation of medicine from a collection of superstitions and harmful practices to a scientific discipline based on evidence and compassion represents one of humanity's greatest achievements. But this transformation came at an enormous cost in human suffering, and we should never forget the price that was paid for our current medical knowledge and capabilities. The story of ancient medicine also reminds us that medical progress is not automatic, and that we must continually work to improve medical practice and patient care. The same critical thinking and scientific rigor that eventually led to the rejection of bloodletting, mercury treatments, and other harmful practices must be applied to current medical treatments to ensure that we continue to do more good than harm. As we conclude this examination of the horrifying reality of ancient medicine, we can appreciate how fortunate we are to live in an era of relatively safe and effective medical care. But we should also remember that our current medical knowledge and practices are built on the suffering of countless patients throughout history, and we owe it to them to continue working toward even better, safer, and more compassionate medical care for all people. The next time you visit a doctor, receive an injection, or undergo surgery, remember the patients of ancient times who endured unimaginable suffering in the name of healing. Their pain was not meaningless if it helps us to appreciate the medical advances we now take for granted and motivates us to continue improving medical care for future generations. But our journey through medical horror is far from over. We've barely scratched the surface of the nightmarish reality that was ancient healthcare. Let's delve deeper into some of the most specialized and terrifying aspects of historical medicine that will make you grateful for every modern medical advancement we have today. Let's begin with one of the most viscerally horrifying aspects of ancient medicine: dental care. If you think going to the dentist today is unpleasant, imagine what dental treatment was like when the only tools available were crude metal implements. No anesthesia existed, and the prevailing theory was that tooth pain was caused by tiny worms living inside your teeth. Ancient dental practices were based on the belief that tooth decay was caused by toothworms, microscopic creatures that burrowed into teeth and gnawed them from the inside. This theory persisted for thousands of years across multiple civilizations, from ancient Babylon to medieval Europe, and it led to treatments that were designed to kill or remove these imaginary parasites. The most common treatment for toothworms involved heating metal instruments until they were red hot, and then applying them directly to the affected tooth. The theory was that the heat would kill the worm and cauterize the infected tissue, preventing further decay. In practice, this treatment caused excruciating pain, destroyed healthy tooth structure, and often led to severe infections that could spread to the jawbone and brain. Imagine sitting in an ancient dental chair, which was usually just a regular chair, or sometimes no chair at all, while a practitioner approached you with a glowing hot iron rod. There was no anesthesia, no pain medication, and no way to numb the area. You would be expected to remain still while the hot metal was pressed directly against your tooth, burning through enamel, dentin, and nerve tissue. The smell of burning tooth and flesh would fill the air, and the pain would be so intense that many patients lost consciousness during the procedure. But hot irons were just one of many horrifying dental treatments used throughout history. Ancient dentists also used various caustic chemicals to burn away tooth decay, including acids derived from plants, minerals, and even animal waste. These substances would be applied directly to the tooth using primitive brushes or by stuffing the cavity with chemical-soaked cloth. Arsenic was a particularly popular dental treatment in many ancient civilizations. Dentists believed that arsenic could kill toothworms and prevent further decay, so they would place small amounts of arsenic paste directly into cavities. The arsenic would slowly dissolve, poisoning not only any bacteria in the tooth but also the patient's entire system. Arsenic poisoning causes nausea, vomiting, diarrhea, and eventual organ failure, but these symptoms were often attributed to other causes rather than to the dental treatment. Ancient tooth extraction was even more brutal than decay treatment. Without anesthesia or proper tools, extracting a tooth was a traumatic ordeal that often resulted in broken jawbones, severe bleeding, and life-threatening infections. Ancient dentists used various crude instruments for tooth extraction, including pliers designed for metalwork, specialized tooth keys that could fracture teeth and jaws, and even simple ropes tied around teeth and pulled by human or animal power. The tooth key was one of the most notorious dental instruments in history. It consisted of a metal shaft with a claw-like end that was inserted into the mouth and positioned against the tooth to be extracted. The dentist would then rotate the key, using leverage to loosen and remove the tooth. However, the tooth key often slipped, crushing adjacent teeth, fracturing the jawbone, or tearing large pieces of gum tissue. Many patients were left with permanent facial deformities and chronic pain after tooth key extractions. Some ancient cultures developed even more extreme methods of tooth extraction. In certain parts of Africa and Asia, teeth were extracted by tying them to arrows and shooting the arrows from bows, using the projectile force to pull the tooth from the jaw. This method was supposed to be quicker and less painful than manual extraction, but it often resulted in shattered teeth, broken jaws, and severe facial injuries. Ancient dental prosthetics were another source of medical horror. Wealthy patients who had lost teeth could sometimes afford replacement teeth, made from various materials including wood, bone, ivory, and even teeth extracted from other people. These prosthetic teeth were attached to remaining teeth, or to the jawbone using primitive wire, leather strips, or metal clasps. The process of fitting dental prosthetics was extremely painful and often unsuccessful. The prosthetic teeth rarely fit properly, causing constant pain and making eating difficult or impossible. The materials used for prosthetics were often porous and unsanitary, harboring bacteria and causing chronic infections. Metal clasps and wires would corrode in the mouth, releasing toxic metals into the patient's system. Perhaps most disturbing of all were the human teeth used for prosthetics. These teeth were often extracted from recently deceased bodies, including plague victims, criminals, and battle casualties. The teeth would be cleaned superficially and then implanted into the patient's mouth, often carrying diseases and infections from their previous owners. Some dental prosthetics were made from teeth extracted from living people, including slaves, prisoners, and poor individuals who sold their teeth for money. Ancient cultures also developed various treatments for gum disease and oral infections that were based on incorrect theories about the causes of these conditions. Many treatments involved applying caustic substances to the gums, including acids, salts, and various plant extracts that caused chemical burns and tissue destruction. One particularly horrifying treatment for gum disease involved scraping away infected tissue with sharp metal instruments, then packing the wounds with various substances including honey, wine, and animal fats. While honey actually has some antibacterial properties, the scraping procedure often caused severe damage to healthy tissue and introduced new infections into the wounds. Ancient dentists also performed primitive forms of oral surgery to treat various conditions including tumors, cysts, and facial injuries. These procedures were performed without anesthesia, using crude instruments, and the mortality rate was extremely high. Patients who survived oral surgery often suffered from permanent disfigurement, chronic pain, and difficulty eating or speaking. Moving beyond dental horrors, let's examine the nightmarish world of ancient obstetric and gynecological medicine. Childbirth and women's reproductive health were areas where ancient medical ignorance and cultural misogyny combined to create some of the most horrifying medical practices in human history. Ancient understanding of female anatomy was virtually non-existent, and most medical theories about women's bodies were based on superstition, religious doctrine, and profound ignorance about basic physiology. Women were often viewed as inherently defective versions of men, and their reproductive organs were seen as sources of illness, moral corruption, and supernatural influence. The ancient Greek theory of the wandering womb was one of the most persistent and harmful ideas in the history of women's medicine. According to this theory, the uterus was a mobile organ that could travel around the body, causing various symptoms depending on where it settled. If a woman experienced headaches, the uterus had wandered to her head. If she had stomach problems, the uterus had moved to her abdomen. Mental illness was often attributed to the uterus wandering to the brain. Treatments for wandering womb were designed to lure the uterus back to its proper position, using strong-smelling substances. Women would be subjected to fumigation treatments where pungent herbs, spices, or even burning animal dung would be placed near their genitals, while foul-smelling substances were held near their noses. The theory was that the uterus would flee from the bad smell and move toward the good smell, returning to its proper position. These fumigation treatments were not only useless but often dangerous. The smoke and chemical fumes could cause respiratory problems, chemical burns, and toxic poisoning. Women would be forced to endure these treatments for hours or days, often while restrained to prevent them from escaping the nauseating fumes. Ancient cesarean sections were among the most horrifying procedures in medical history. The operation was almost always fatal for the mother, and was typically performed only after she had died, or was clearly dying. The primary purpose was to save the baby's life, or to ensure that the baby could be baptized before death. The cesarean procedure involved cutting through the abdominal wall and uterus with crude knives or razors, while the woman was fully conscious. There was no anesthesia, no antiseptic technique, and no way to control bleeding effectively. The mother would experience unimaginable pain as her abdomen was cut open and her baby extracted from her womb. Most women died during or immediately after the cesarean procedure from blood loss, shock, or infection. Those who survived the initial surgery usually died within days from sepsis or other complications. The babies extracted through cesarean section had a slightly better survival rate, but many were injured during the procedure or died from complications related to the traumatic birth. Ancient treatments for difficult labor were based on the belief that prolonged labor was caused by moral failings, supernatural influences, or physical defects in the woman's body. Women in labor might be subjected to violent shaking, hanging upside down, or being thrown around to encourage the baby to move into the proper position. Some cultures practiced a technique called version, where the midwife or physician would reach into the uterus and manually manipulate the baby's position. This procedure was performed without anesthesia or antiseptic precautions, and it often resulted in uterine rupture, massive bleeding, and death for both mother and baby. Ancient cultures also developed various instruments for assisting with difficult deliveries, but these instruments were often more harmful than helpful. Primitive forceps made from wood, bone, or metal were used to grasp the baby's head and pull it from the birth canal. These early forceps often crushed the baby's skull or caused severe injuries to the mother's birth canal. In cases where the baby had died in the womb, ancient physicians used specialized instruments to dismember the dead fetus and extract it piece by piece. This procedure, called embryotomy, involved inserting hooks, knives, and crushing devices into the uterus to cut the dead baby into pieces small enough to be removed. The embryotomy procedure was performed while the mother was fully conscious and aware of what was happening. She would experience the physical pain of having sharp instruments inserted into her body, as well as the psychological trauma of knowing that her dead baby was being cut apart inside her. The procedure could take hours to complete, and many mothers died from blood loss, infection, or emotional shock. Ancient cultures also had various treatments for infertility that were based on incorrect theories about the causes of reproductive problems. Women who failed to conceive might be subjected to treatments that included bloodletting, purging, and the application of various substances to their reproductive organs. Some infertility treatments involved inserting foreign objects into the uterus, including pieces of wood, metal, or stone that were supposed to stimulate conception. These objects often caused severe infections, internal injuries, and chronic pain. Other treatments involved consuming various potions and elixirs that contained toxic substances, including mercury, lead, and various plant poisons. Ancient contraceptive methods were equally dangerous and often ineffective. Women might insert various substances into their vaginas to prevent pregnancy, including acids, plant extracts, and animal waste. These substances could cause chemical burns, infections, and permanent damage to the reproductive organs. Some ancient contraceptive methods involved consuming toxic substances that were supposed to prevent conception. Women would drink potions containing lead, mercury, or various plant poisons that were believed to make them temporarily infertile. These substances often caused severe poisoning and could result in permanent organ damage or death. Ancient treatments for menstrual problems were based on the belief that menstruation was a form of purification that removed corrupted humors from the body. Women who experienced irregular or painful menstruation might be subjected to treatments designed to increase or regulate their menstrual flow. Bloodletting was commonly used to treat menstrual problems, with physicians removing blood from various parts of the body to supplement or replace the menstrual flow. Women might have blood removed from their arms, legs, or even directly from their genital area using leeches or cutting instruments. Other treatments for menstrual problems involved inserting various substances into the vagina or uterus to stimulate bleeding. These substances often included irritating chemicals, sharp objects, or infected materials that could cause severe injuries and life-threatening infections. Now let's turn our attention to another horrifying aspect of ancient medicine: the treatment of infectious diseases and epidemics. Throughout history, humanity has been repeatedly devastated by epidemic diseases, including plague, cholera, smallpox, and typhus. Ancient medical responses to these epidemics were not only ineffective, but often made the situations worse by spreading infection and weakening patients who might otherwise have survived. The Black Death, which killed an estimated 1/3 of Europe's population in the 14th century, provides some of the most horrifying examples of misguided medical treatment during epidemic disease. Medieval physicians had no understanding of the bacterial cause of plague, and their treatments were based on theories about corrupted air, astrological influences, and divine punishment. Plague treatments typically involved aggressive bloodletting to remove the corrupted humors that were supposedly causing the disease. Patients who were already weakened by plague infection would have large quantities of blood removed, further reducing their ability to fight the disease. Many plague victims died from blood loss and anemia rather than from the plague itself. Medieval physicians also treated plague by lancing the characteristic buboes or swollen lymph nodes that appeared on plague victims. The buboes would be cut open with crude knives or heated irons, and the infected fluid would be drained out. This procedure was performed without anesthesia and often spread the infection to other parts of the body or to other people. The drainage from plague buboes was sometimes collected and used as medicine for other patients, based on the theory that exposure to the disease would provide immunity. This practice actually spread plague infection more widely and contributed to the rapid spread of the epidemic. Medieval physicians also used various chemical treatments for plague, including mercury, arsenic, and other toxic substances. Patients would be given these poisons internally or have them applied to their skin, causing additional suffering and often hastening death from poisoning rather than infection. During plague epidemics, entire communities would be subjected to mass medical treatments that were supposed to prevent or cure the disease. These treatments might include fumigation with burning herbs, mass bloodletting sessions, and the administration of various potions and elixirs to entire populations. Public fumigation treatments involved burning large quantities of aromatic substances in public spaces, creating thick clouds of smoke that were supposed to purify the air and prevent disease transmission. These fumigation sessions often caused respiratory problems and chemical poisoning among the participants, and they had no effect on the spread of plague. Cholera epidemics in the 19th century led to similarly misguided medical treatments that often made the disease worse. Cholera causes severe dehydration through vomiting and diarrhea, but 19th century physicians didn't understand the importance of fluid replacement and often used treatments that caused further fluid loss. Cholera patients were routinely subjected to aggressive bloodletting, purging, and the administration of various drugs that increased vomiting and diarrhea. These treatments accelerated dehydration and often killed patients who might have survived with supportive care and fluid replacement. One particularly brutal cholera treatment involved submerging patients in ice-cold water or packing them in ice to reduce their body temperature. This treatment was based on the theory that cholera was caused by excessive heat in the body, but the cold shock often caused cardiac arrest and respiratory failure in patients who were already severely ill. Smallpox epidemics throughout history led to various misguided medical treatments that often increased mortality rates rather than reducing them. Before the development of vaccination, smallpox was treated with methods that were supposed to drive the disease from the body or modify its course. Smallpox patients were often subjected to bloodletting, purging, and various chemical treatments that weakened their immune systems and made them more susceptible to secondary infections. The characteristic smallpox rash was sometimes treated with caustic chemicals or heated irons that were supposed to dry up the lesions but actually caused additional tissue damage and scarring. Some cultures practiced variolation, a primitive form of smallpox inoculation that involved deliberately infecting healthy people with smallpox material from infected patients. While variolation did provide some protection against natural smallpox infection, it also caused many deaths and often triggered smallpox epidemics in previously unaffected populations. The variolation procedure typically involved making small cuts in the patient's skin and inserting smallpox-infected material into the wounds. Patients would then develop a supposedly mild case of smallpox that would provide lifelong immunity. However, the smallpox induced by variolation was often indistinguishable from naturally acquired smallpox and carried the same risks of death and complications. Typhus epidemics, which were common in overcrowded cities and military camps, were treated with methods that often spread the disease more widely. Typhus is transmitted by body lice, but ancient and medieval physicians didn't understand this mode of transmission and used treatments that actually encouraged lice infestation. Typhus patients were often confined in overcrowded, poorly ventilated spaces where lice could easily spread from person to person. The lack of attention to hygiene and the practice of reusing clothing and bedding from infected patients helped to maintain and spread typhus epidemics. Medical treatments for typhus included bloodletting, purging, and various chemical treatments that weakened patients and made them more susceptible to complications. The high fever associated with typhus was often treated with cold water immersion or ice packing that could cause thermal shock and cardiac arrest. Now, let's explore another deeply disturbing aspect of ancient medicine: the treatment of mental illness and neurological disorders. Throughout history, mental illness has been one of the most misunderstood and mistreated conditions in medicine, leading to treatments that were often indistinguishable from torture. Ancient understanding of mental illness was based on supernatural beliefs, religious doctrine, and profound ignorance about brain function. Mental illness was often attributed to demon possession, divine punishment, moral weakness, or various physical imbalances that could supposedly be corrected through aggressive medical intervention. One of the most persistent and harmful treatments for mental illness was trepanation, the practice of drilling holes in the skull to release evil spirits or relieve pressure on the brain. Trepanation was practiced by virtually every ancient civilization and continued well into the modern era, despite having no beneficial effects and causing enormous suffering and death. The trepanation procedure involved restraining the patient and using various drilling, scraping, or cutting tools to create openings in the skull. The tools used for trepanation were often crude and unsanitary, including sharpened stones, metal awls, saws, and specialized drilling devices that were operated by hand. Patients undergoing trepanation were fully conscious during the procedure, as there was no effective anesthesia available. They would experience excruciating pain as the surgeon worked through the layers of skin, muscle, and bone to reach the brain tissue underneath. The sound of drilling or scraping through bone, combined with the smell of burning bone dust and blood, created a horrifying sensory experience for both patient and observers. Many patients died during trepanation from blood loss, shock, or brain damage. Those who survived the initial procedure often developed severe infections that led to brain abscesses, meningitis, and death. The holes in the skull rarely healed properly, leaving patients with permanent skull defects and increased vulnerability to head injuries. Ancient physicians also used various chemical treatments for mental illness that were based on incorrect theories about brain function. Mercury was commonly used to treat mental disorders, based on the belief that it could drive out evil spirits or correct chemical imbalances in the brain. Mental patients would be given mercury internally, have it applied to their skin, or be exposed to mercury vapors in enclosed spaces. Mercury poisoning causes severe neurological damage, including tremors, memory loss, personality changes, and psychosis. These symptoms were often interpreted as signs that the treatment was working and that the evil spirits were being driven from the patient's body. Lead was another common treatment for mental illness, used both internally and externally. Patients might consume lead-based medicines or have lead-containing poultices applied to their heads. Lead poisoning causes brain damage, seizures, and behavioral changes that often made the patient's mental condition worse rather than better. Ancient treatments for mental illness also included various forms of physical restraint and isolation that were designed to control the patient's behavior rather than treat their underlying condition. Mental patients might be chained to walls, confined in small cells, or restrained in devices that prevented normal movement and social interaction. The use of restraints in ancient mental health treatment was often brutal and dehumanizing. Patients might be chained in positions that caused chronic pain and physical deformity, left in their own waste for extended periods, or subjected to various forms of physical punishment that were supposed to shock them back to sanity. Ancient asylums and madhouses were often little more than prisons where mentally ill patients were confined and forgotten. The conditions in these institutions were appalling, with patients housed in overcrowded, unsanitary facilities where abuse and neglect were common. Patients in ancient asylums were often subjected to experimental treatments that had no scientific basis and were designed more to control their behavior than to improve their mental health. These treatments might include various forms of sensory deprivation, exposure to extreme temperatures, and the administration of toxic substances that caused additional psychological and physical trauma. Ancient physicians also developed various mechanical devices for treating mental illness that were designed to shock, disorient, or physically manipulate patients. These devices included spinning chairs, swing machines, and various contraptions that subjected patients to violent motion, pressure, or restraint. The spinning chair treatment involved strapping patients into chairs that could be rotated at high speed, causing severe motion sickness, disorientation, and sometimes loss of consciousness. The theory was that spinning would redistribute blood flow in the brain and restore normal mental function, but the treatment often caused additional psychological trauma and physical injuries. Ancient treatments for epilepsy and other neurological disorders were equally horrifying and misguided. Epilepsy was often attributed to demon possession or divine punishment, leading to treatments that focused on exorcism and spiritual purification rather than medical care. Epileptic patients might be subjected to various forms of shock treatment, including immersion in cold water, exposure to loud noises, or the application of painful stimuli during seizures. These treatments were supposed to interrupt the seizure activity, but they often caused additional injuries and psychological trauma. Some cultures practiced human sacrifice as a treatment for epilepsy, believing that the blood of sacrificial victims could cure the condition. Epileptic patients might be forced to drink human blood, or have it applied to their bodies during ritual ceremonies that were supposed to drive out the evil spirits causing their seizures. Now, let's examine one of the most disturbing aspects of ancient medicine: the use of human experimentation and the complete disregard for patient consent and well-being. Throughout history, physicians and medical researchers have used vulnerable populations, including slaves, prisoners, and the mentally ill, as unwilling subjects for medical experimentation. Ancient physicians often viewed patients as sources of medical knowledge, rather than as human beings deserving of care and respect. This attitude led to practices that would be considered unethical and criminal by modern standards, but were considered acceptable and even necessary for advancing medical knowledge. Vivisection, the practice of performing surgery on living subjects for research purposes, was common in many ancient civilizations. Physicians would perform experimental procedures on condemned criminals, slaves, and prisoners of war to study anatomy and test new surgical techniques. The vivisection procedures were performed without anesthesia, and the subjects were expected to remain conscious during the experiments so that physicians could observe their reactions and responses. The subjects would experience unimaginable pain and terror as they were cut open and their internal organs examined while they were still alive. Ancient physicians justified vivisection by arguing that the knowledge gained was valuable for treating future patients, and that the lives of criminals and slaves were expendable. in the pursuit of medical advancement. This utilitarian approach to human experimentation continued for centuries and influenced medical practice well into the modern era. Ancient medical schools often required students to perform dissections and surgical procedures on living subjects as part of their training. These educational vivisections were considered essential for learning anatomy and surgical technique, and students were expected to overcome any squeamishness or moral objections they might have about causing pain and suffering to other human beings. The subjects used for educational vivisection were typically people with no social status or legal protection, including slaves, criminals, and prisoners of war. They had no choice in the matter, and no way to escape or resist the procedures that were performed on them. Ancient physicians also conducted experiments on patients without their knowledge or consent, testing new drugs, surgical techniques, and treatments on people who came to them seeking help for medical problems. Patients had no way of knowing whether they were receiving established treatments or experimental procedures, and physicians felt no obligation to inform them or obtain their permission. These unauthorized medical experiments often resulted in serious injuries, permanent disabilities, and death for the unwitting subjects. Physicians would observe and record the results of their experiments, using the suffering of their patients to advance their own knowledge and reputation. Some ancient cultures practiced medical experimentation on entire populations during epidemics and health crises. Physicians would test new treatments and prevention methods on large groups of people without obtaining consent or informing them about the experimental nature of the interventions. During plague epidemics, for example, physicians might divide affected populations into different groups and subject each group to different experimental treatments to see which methods were most effective. The people subjected to these experiments had no choice in the matter, and no way to opt out of treatments that might be harmful or ineffective. Ancient military medicine also involved extensive human experimentation, as army physicians tested new treatments and surgical techniques on wounded soldiers. Soldiers had no choice but to accept whatever treatments were offered, and military physicians often used battlefield casualties as opportunities to experiment with new procedures. The wounded soldiers used for medical experimentation were often those with the most severe injuries, who were considered unlikely to survive regardless of treatment. Physicians would try experimental procedures on these patients, justifying their actions by arguing that any chance of success was worth the attempt, regardless of the additional pain and suffering caused. Ancient physicians also conducted experiments on pregnant women and newborn babies, testing various obstetric procedures and treatments without regard for the safety of mother or child. These experiments often resulted in complications that could have been avoided with more conservative treatment approaches. Pregnant women had no legal rights or protections in most ancient societies, and physicians could subject them to experimental procedures without obtaining consent from them or their families. The high mortality rates associated with childbirth provided cover for experimental treatments that might otherwise have been questioned. Ancient pediatric medicine also involved extensive experimentation on children, who were particularly vulnerable to medical abuse because they had no legal standing and were considered the property of their parents or guardians. Children were subjected to experimental treatments and procedures that were often more harmful than beneficial. The use of children for medical experimentation was particularly common in ancient cultures that practiced child sacrifice or had high rates of infant mortality. Children who were expected to die anyway were often used as subjects for experimental treatments that might provide useful information for treating other patients. Now let's explore another horrifying aspect of ancient medicine: the development and use of medical instruments that were often indistinguishable from torture devices. Ancient physicians created an array of tools and devices that were designed to perform medical procedures, but many of these instruments caused extreme pain and suffering, and were often more harmful than helpful. Ancient surgical instruments were typically crude, unsanitary, and poorly designed for their intended purposes. They were often made from materials that were inappropriate for medical use, including rusted iron, sharpened stones, and wood that harbored bacteria and other contaminants. One of the most notorious ancient medical instruments was the bone saw, used for amputations and other surgical procedures involving bone cutting. Ancient bone saws were typically hand-operated devices with coarse, irregular teeth that required repeated back-and-forth motions to cut through bone. The bone saw procedure was performed without anesthesia, and patients would be fully conscious during the cutting process. The saw would often bind or stick in the bone, requiring the surgeon to apply additional force and causing the blade to tear through tissue rather than cutting cleanly. The sound of the saw grinding through bone, combined with the patient's screams, created a horrifying experience for everyone involved. Ancient cauterization tools were another source of medical horror. These instruments were used to burn and seal blood vessels, remove diseased tissue, and treat various conditions by applying intense heat directly to the body. Cauterization tools included heated metal rods, burning coals, and specialized devices that could be heated to extreme temperatures. The cauterization procedure involved pressing red-hot metal against the patient's flesh, causing immediate and severe burns. The smell of burning tissue, the sound of sizzling flesh, and the intense pain experienced by the patient made cauterization one of the most dreaded medical procedures in ancient times. Ancient trepanation tools were designed specifically for drilling holes in the skull, and they came in various forms depending on the culture and time period. Some trepanation tools were simple awls or pointed instruments that were rotated by hand to gradually bore through the skull bone. Others were more complex devices with multiple cutting edges or scraping surfaces. The trepanation procedure required enormous physical effort from the surgeon, who might spend hours working to create a single hole in the skull. The patient would be conscious throughout the procedure, experiencing the pain of having their skull slowly penetrated by the drilling tool. Ancient bloodletting instruments included a variety of devices designed to open veins and arteries and control the flow of blood from the body. These instruments included lancets, fleams, scarificators, and various specialized knives and cutting tools. Bloodletting instruments were often crude and poorly maintained, with dull or damaged cutting edges that would tear through tissue rather than making clean incisions. The lack of sterile technique meant that bloodletting instruments were often contaminated with blood and tissue from previous patients, spreading infections and diseases from one patient to another. Ancient forceps and extraction tools were used for removing foreign objects, extracting teeth, and assisting with childbirth. These instruments were typically made from crude metals and had rough, irregular surfaces that could cause severe tissue damage. Obstetric forceps were particularly dangerous, as they were often used inappropriately and with excessive force. The early versions of obstetric forceps had no safety mechanisms or controls, and they could easily crush the baby's skull or cause severe injuries to the mother's birth canal. Ancient lithotomy instruments were designed for removing kidney and bladder stones through surgical procedures. These instruments included various probes, hooks, and extraction devices that were inserted into the body to locate and remove stones. The lithotomy procedure was one of the most dangerous operations in ancient medicine, with mortality rates exceeding 50%. The instruments used for lithotomy were often inappropriate for their intended use, causing severe internal injuries and complications that were frequently fatal. Ancient eye surgery instruments were used for treating cataracts, removing foreign objects from the eyes, and performing other ocular procedures. These instruments included sharp needles, small knives, and various probing devices that were inserted directly into the eye. Eye surgery was performed without anesthesia or magnification, and surgeons had to work by feel rather than by sight. The crude instruments often caused more damage than they corrected, leading to blindness, infection, and severe pain for the patients. Ancient dental instruments included various extraction tools, drilling devices, and cutting implements that were used for treating tooth decay and removing diseased teeth. These instruments were often repurposed from other uses, including metalworking tools, carpentry implements, and even weapons. The lack of specialized dental instruments meant that dental procedures were often performed with tools that were inappropriate for working in the mouth. This led to unnecessary trauma, broken teeth and jaws, and severe complications that could be life-threatening. Let's now turn our attention to one of the most disturbing aspects of ancient medicine: the treatment of children and the complete disregard for their unique physiological and psychological needs. Ancient pediatric medicine was essentially non-existent as a separate field, and children were typically treated as miniature adults with little consideration for their developmental differences. Ancient understanding of child development was primitive and often based on incorrect theories about the nature of childhood and human growth. Children were often viewed as incomplete or defective adults, rather than as beings with their own unique characteristics and needs. This fundamental misunderstanding of child development led to medical treatments that were often inappropriate and harmful for young patients. Children might be subjected to the same aggressive treatments used for adults, including bloodletting, purging, and the administration of toxic substances, but at doses that were poorly calculated and often dangerous. Ancient physicians had no understanding of appropriate pediatric dosing for medications and other treatments. They might simply give children smaller amounts of adult medications without considering the different ways that children's bodies process and respond to drugs. This led to frequent cases of overdose, poisoning, and adverse reactions in pediatric patients. Childhood diseases were often attributed to moral failings, supernatural influences, or hereditary defects that required aggressive treatment to correct. Children with common childhood illnesses might be subjected to brutal treatments that were designed to purge evil influences or correct supposed imbalances in their bodies. Ancient treatments for childhood fever often involved extreme measures that were more dangerous than the original illness. Children with fevers might be subjected to ice-cold baths, bloodletting, or the administration of toxic substances that were supposed to reduce their body temperature but often caused hypothermia, shock, or poisoning. Childhood mental health problems were often viewed as evidence of moral corruption or supernatural influence, leading to treatments that were designed to punish or exorcise the child rather than provide appropriate care. Children with developmental disabilities or behavioral problems might be subjected to physical restraint, isolation, or various forms of correction that were often abusive. Some ancient cultures practiced infanticide as a form of medical treatment, killing newborn babies who were considered defective, weak, or unlikely to survive. This practice was often justified on medical grounds, with physicians arguing that it was more humane to end the child's life quickly rather than allow them to suffer from their conditions. Ancient surgical procedures on children were particularly horrifying, as children were often unable to understand what was happening to them and had no way to cooperate with or consent to their treatment. Children undergoing surgery would be physically restrained while experiencing unimaginable pain and terror. Childhood injuries were often treated with methods that caused additional trauma and complications. Children with broken bones might have their limbs reset forcibly without anesthesia, often causing additional fractures and soft tissue damage. The lack of understanding about proper bone healing meant that many children were left with permanent deformities and disabilities. Ancient treatments for childhood skin conditions often involved the application of caustic substances that could cause severe chemical burns. Children with rashes, infections, or other skin problems might have acids, salts, or other irritating substances applied directly to their skin, causing pain and scarring that could last for life. Childhood respiratory problems were often treated with methods that could worsen the condition or cause additional complications. Children with coughs or breathing difficulties might be subjected to smoke inhalation treatments, chest compression, or the administration of substances that could cause respiratory depression. Ancient dental care for children was particularly brutal, as children's teeth were often extracted or treated with the same methods used for adults, regardless of whether the teeth were permanent or primary. Children might have healthy teeth extracted unnecessarily, or have diseased teeth treated with caustic chemicals that could damage developing permanent teeth. Now let's examine another deeply disturbing aspect of ancient medicine: the treatment of disabilities and the complete lack of understanding about accommodation and support for people with physical and mental impairments. Ancient societies typically viewed disability as a curse, punishment, or sign of moral failing, leading to treatments that were often more harmful than helpful. Ancient understanding of disability was based on supernatural beliefs and moral judgments rather than medical knowledge. People with disabilities were often considered to be cursed by gods, possessed by demons, or suffering from divine punishment for their own sins, or the sins of their ancestors. This fundamental misunderstanding of disability led to treatments that were focused on punishment, exorcism, or attempts to restore the person to normal function through aggressive medical intervention. The concept of accommodation or support for people with disabilities was virtually unknown in ancient societies. People with physical disabilities were often subjected to brutal treatments that were supposed to cure their conditions or make them more acceptable to society. Those with limb deformities might be subjected to mechanical stretching, breaking and resetting of bones, or even amputation of affected limbs. Ancient treatments for blindness often involved procedures that could cause additional eye damage or complications. Blind people might be subjected to surgical procedures, chemical treatments, or various forms of shock therapy that were supposed to restore their sight, but often caused pain and further visual impairment. People with hearing impairments were often subjected to treatments that involved inserting foreign objects into their ears, applying caustic substances to their ear canals, or undergoing surgical procedures that could cause additional hearing loss or complications. Ancient treatments for intellectual disabilities were particularly cruel and often involved attempts to shock or punish the person into normal behavior. People with cognitive impairments might be subjected to physical abuse, isolation, starvation, or various forms of therapy that were designed to force them to think and behave more typically. People with mental illness, who also had physical disabilities, were often subjected to especially harsh treatment, as they were considered to be doubly cursed or possessed. They might be confined in institutions where they received no medical care and were treated more like prisoners than patients. Ancient societies often practiced infanticide or abandonment of babies born with disabilities, viewing them as unlucky omens or burdens on their families and communities. Babies with visible birth defects might be killed immediately after birth, or left to die from exposure or neglect. Those people with disabilities who were allowed to live often faced lives of extreme hardship and social isolation. They might be forced to beg for survival, used as entertainment or curiosities, or confined to institutions where they were neglected and abused. The lack of understanding about the causes of disability led to treatments that often made the person's condition worse. People with seizure disorders might be subjected to exorcism rituals, physical restraint, or the administration of toxic substances that could cause additional neurological damage. Ancient prosthetic devices were crude and often caused more problems than they solved. People with amputations might be fitted with wooden or metal devices that were painful to wear, poorly fitted, and prone to causing infections and sores. The social stigma associated with disability in ancient societies often prevented people from seeking or receiving any form of medical care. People with disabilities were often hidden away by their families or abandoned to fend for themselves, receiving no treatment or support for their conditions. Now let's explore one final aspect of ancient medical horror: the use of exotic and dangerous substances as medicines, and the complete lack of understanding about drug safety and toxicology. Ancient pharmacology was based on magical thinking, superstition, and the belief that the more exotic and expensive a substance was, the more powerful its healing properties must be. Ancient physicians had access to a vast array of substances that they used as medicines, including minerals, plants, animal parts, and even human remains. Many of these substances were highly toxic and caused severe poisoning and death. But they continued to be used because physicians didn't understand the connection between the treatment and the adverse effects. Mercury was one of the most widely used and dangerous substances in ancient medicine. It was used to treat a variety of conditions, including syphilis, mental illness, and various skin diseases. Mercury compounds were given internally, applied to the skin, or used in vapor form for patients to inhale. Mercury poisoning causes severe neurological damage, including tremors, memory loss, personality changes, and eventually death. But ancient physicians interpreted the symptoms of mercury poisoning as signs that the treatment was working and that the disease was being driven from the body. Lead was another common and dangerous medicine used throughout ancient history. Lead compounds were used to treat stomach ailments, skin conditions, and as general tonics for improving health. Lead acetate, known as sugar of lead, because of its sweet taste, was particularly popular and was often given to children as a medicine. Lead poisoning causes brain damage, organ failure, and death, but the symptoms often develop slowly over time, so physicians didn't make the connection between the treatment and the patient's deteriorating condition. Many people suffered from chronic lead poisoning throughout their lives, without knowing that their medical treatments were the cause of their problems. Arsenic was widely used in ancient medicine to treat various conditions including skin diseases, digestive problems, and mental illness. Arsenic compounds were applied to the skin, taken internally, or used in vapor form. Arsenic is highly toxic and causes organ failure, neurological damage, and death. But it was considered a powerful and effective medicine. Many ancient cultures used powdered mummy remains as medicine, believing that the preserved flesh of ancient Egyptians had special healing properties. Mummy powder was expensive and considered a luxury medicine for wealthy patients. In reality, mummy powder had no medicinal value and often contained bacteria and other pathogens that could cause infections and diseases. Various animal parts were used as medicines based on the belief that consuming parts of certain animals would transfer their characteristics to the human patient. People might consume ground tiger bone for strength, rhino horn for virility, or bear gallbladder for courage. These substances had no medicinal value and often caused digestive problems and other complications. Human body parts were also used as medicines in many ancient cultures. People might consume powdered human skull for headaches, drink human blood for various ailments, or use human fat as a topical treatment. These practices were not only medically useless, but also carried risks of disease transmission and psychological trauma. Precious stones and metals were often ground into powder and used as medicines, based on the belief that their value and beauty indicated powerful healing properties. Patients might consume powdered pearls, ground diamonds, or gold dust as treatments for various conditions. These substances were not only expensive and useless, but could also cause intestinal blockages and other complications. Various plant-based medicines used in ancient times were highly toxic and often caused more harm than good. Plants containing cardiac glycosides, alkaloids, and other poisonous compounds were commonly used without any understanding of their toxic effects. Hellebore, a plant containing cardiac glycosides, was commonly used to induce vomiting and purging, but it could also cause cardiac arrest and death. Patients would be given increasingly large doses until they began vomiting violently, and many died from the treatment rather than the original illness. Opium was used medicinally in many ancient cultures, but without understanding of proper dosing or the risk of addiction and overdose. Patients might be given large quantities of opium for pain relief, often resulting in respiratory depression, coma, and death. The lack of quality control in ancient pharmacy meant that medicines often contained unknown or variable amounts of active ingredients, making dosing unpredictable and dangerous. The same medicine might be harmless in one preparation and deadly in another, depending on factors that were not understood or controlled. Ancient physicians often combined multiple toxic substances in complex preparations, believing that more ingredients would make the medicine more powerful. These polypharmacy preparations increased the risk of toxic interactions and adverse effects, often making patients sicker rather than better. The horrifying reality of ancient medicine serves as both a testament to human resilience and a warning about the dangers of medical practices that are not based on scientific evidence and genuine concern for patient well-being. As we continue to advance medical knowledge and practice, we must never forget the lessons learned from this dark chapter in human history, and we must always strive to ensure that medicine serves to heal rather than to harm. The countless patients who suffered through these primitive and often dangerous treatments were not just victims of ignorance, but unwilling participants in humanity's long and painful journey toward understanding the human body and the nature of disease. Their suffering was not meaningless if it helps us to appreciate the medical advances we now take for granted and motivates us to continue improving medical care for future generations. As we conclude this examination of the horrifying reality of ancient medicine, we can see that while medical practice has evolved dramatically over the centuries, the fundamental challenge remains the same: how to help sick and suffering people without causing additional harm. The history of medicine is a reminder that good intentions are not enough, and that rigorous scientific evaluation and compassionate patient care must always be the foundation of medical practice. The next time you visit a doctor, undergo a medical procedure, or take a medication, remember the patients of ancient times who endured unimaginable suffering in the name of healing. Their pain and sacrifice paved the way for the safe and effective medical care we enjoy today, and we owe it to them to continue working toward even better, safer, and more compassionate medical care for all people.